Good afternoon, everyone, and thank you for joining us today on our May webinar. I'm Gillian Henderson, Head of Innovation Commercialisation with InnoScot Health. We run these webinars each month and they focus on a variety of topics, all with common interest themes for our innovators and partners. Today, we are very fortunate to be joined by Dr. Sanna Rimpiläinen of DHI and Yazmin, Cáceres, Digital Health Consultant. They are going to share the findings of their very recently completed work on the mapping of the digital health ecosystem. So this work maps Scotland's digital health and social care innovation ecosystem. It's using a combined framework to look at the support provided by academia, industry, public and civic organisations, and third sector. So alongside an analysis of the types of support available and how that support aligns to technology, business and service readiness levels, the report was launched just last week, so we are very pleased that they were able to join us today and share more about that. Also on today's session is my colleague Frances Ramsey. Frances is our Head of Business Development and she will be monitoring the chat. So if you've got any questions as we go through things, just pop them in there and we'll have plenty of time to pick them up at the end. So just by way of housekeeping, today's session will be recorded. And if you're joining us for the first time, you can find all of our previous sessions on the InnoScot YouTube channel, which you can access via our website. So InnoScot has been involved in the health tech ecosystem for over 20 years. We recognise that it can be tricky to navigate and to find the right support at the right point in your project. We were initially set up by Scottish Government in 2002 to support the NHS to identify, protect and commercialise intellectual property from within the NHS. Over the years, we've worked in collaboration with academia and industry to bring technologies from within the NHS into the marketplace, into use, and generating revenue and impact. So we can engage with innovators at any point in that development process and innovation maturity with particular expertise at the early development stage. So we can offer evaluation, market analysis, and early stage health economic analysis. But we do offer that comprehensive support across the full product development lifecycle, including assistance with regulatory compliance pathway for medical devices. We're also now able to operate more flexibly in terms of who we can work with, meaning that we can work with any organisation under contract with us. We can expand the offer of our services to non-NHS clients, including innovators, startups and international partners. And we're also working on the expansion of our already growing consultancy services in regulatory affairs, commercialisation, training and investment readiness. So on this basis, this is InnoScot's full service portfolio, which is the complete suite of support now available to innovators across all sectors. So our work is, as I mentioned, mainly focused on those early stage innovators. So those at the concept and pre-prototype stage, although some of our functions do support right through the full development lifecycle. So these service pillars all sit around our core purpose, which is to discover, assess and commercialise innovations. And this central mission really reflects our long-standing remit as a technology transfer and innovation partner, historically for NHS Scotland, but now open to all innovators. So obviously, being involved in the ecosystem for the past 23 years, we have developed significant expertise in the elements which support that core purpose. So intellectual property management, our team can provide end-to-end intellectual property support. So this isn't just patents, we can also advise on copyright, trademarking, design registration, and helping you to unlock the value in your knowledge and know-how. So we can support with IP strategy, patent evaluation, filing, renewals, licensing and spin-out management. And this has been the core part of our TTO responsibilities for over 2 decades, and it does remain central to how we protect and maximise value from innovations. We also do product development support, so we can support innovators through the entire development process, prototyping, validation, design for manufacturer, usability testing, risk management and eventual transfer to manufacturing. All of our development work is undertaken within our certified quality management system, so we are factoring in that compliance pathway from the outset. Depending on the project needs, we'll work with partners in academia, industry and the private sector to design and develop for manufacture. Commercialisation, which includes our go-to-market strategy, pricing, business modelling, partnership structuring and licensing pathways. We've delivered more than 30 commercial licence deals and helped multiple innovations reach national and international markets. So we can work with you to find a partner to move your innovation forward and get it into the market. Our media and communications team help innovators articulate their story, which improves visibility with investors, stakeholders and clinical partners. So that can strengthen engagement and your support innovators' credibility as we move forward into market adoption. We also offer income oversight. So as innovators move into a commercial phase, we can manage revenue flows such as licensing income, royalty agreements or revenue shares. So this ensures transparency and accountability while maintaining good governance. Our industry and investor partnership team work across networks to connect innovators with the right industry partners, funders and investors. We also support due diligence preparation and investor readiness work. A significant part of our value is guiding innovators through regulatory and compliance, helping them define their pathway to compliance and getting their innovation to market. So that might be UKCA, CE or FDA pathways. We can also support with ISO 13485 and 14971, establishing your own QMS and clinical evaluation requirements. We recognise that this is one of the biggest barriers for early stage innovators, so our approach really helps innovators build that expertise within their own team. In terms of our entrepreneurship and startup support, we help founders build the fundamentals of a viable medtech business, whether that's through structured commercialisation programmes, mentorship, business modelling or planning. And we also deliver training, workshops and innovation awareness programmes for clinicians, researchers and early stage companies. So these sessions will cover intellectual property, market analysis, regulatory strategy and investment preparation. We've also got legal support and they can support innovators through contractual guidance, including licensing agreements, collaboration agreements, NDAs and IP ownership structures. So this ensures that innovators are protecting their value from the outset and navigating partnerships with confidence too. In terms of our market analysis, we can generate evidence for decision making and funding applications, looking at unmet need validations, competitor analysis and early stage health economic assessment. So with that, I'm going to hand over to Yazmin and Sanna to hear more about their recent work on their ecosystem landscape analysis. Yazmin is a registered dietitian from Chile with over 10 years experience in public health, clinical nutrition and community-based programs. Over time, she's developed a strong interest in how technology can enhance care, improve access and support vulnerable populations. She is now personally part of Scotland's digital health innovation ecosystem, having developed Sabrain, a digital solution for adolescents and young people with brain tumours, which was selected for funding by Cancer Research Horizons and is part of the Venture Builder Incubator at the University of Edinburgh. So in parallel, she's been working with Digital Health and Care Innovation Centre on research mapping. Sanna leads on DHI's key strategic areas, the skills and future workforce development agenda. So this work stimulates a future pipeline of talent to support the digital transformation of health and care services in Scotland through collaboration with key stakeholders in academia, industry and the civic sectors. With over 25 years of experience in research, she manages DHI's research and knowledge management team who provide an internal research service to inform DHI's work. So I will stop sharing for now.
Thank you, Gillian. I'll just take a little bit of time to share and Yazmin will be first to speak. And Yazmin, just tell me when you want me to move a slide.
Hi, hello everyone. Yeah, I'm ready. Thank you for having me today. Well, good afternoon, everyone. And thank you to InnoScot Health for the invitation to join today's session. I think many people working in digital health in Scotland share a similar experience than me. You have an idea, you know support exists, somewhere in the system, but understanding where to go next can sometimes feel surprisingly difficult. And that is exactly the challenge this work explored. So today, we'll share insight from DHI's report, Navigating Scotland Digital Health and Social Care Innovation Ecosystem, which examined how early stage innovators experience the Scottish innovation landscape, where support is concentrated and where important gaps still remain. Start. The next, please, Sanna. So, why does this mapping matter? There are three main reasons. First, it is a strategic priority. Digital transformation in health and social care is central to Scotland's public service reform. Secondly, we already have a rich ecosystem with an abundance of organizations, but this ecosystem grew faster than the coordination between its parts. So we have abundance, but not always clarity on how to navigate it. And finally, what makes this report different is the entrepreneurial lens. Previous analysis focused on policy and the market, but this report adds the lived experience of the innovators themselves. Next, please. So to gather the evidence, we used three lenses. The first was a desk review, which identified 59 active organizations across the quadruple helix, coded by support function and technology readiness levels. Secondly, we conducted stakeholders consultations in deep conversation with 10 individuals from 9 industry-facing organizations. And the most revealing piece, 3 focus groups with 10 health entrepreneurs at the different stages of innovation. So we then synthesize everything through innovation systems, theory, and service design principles. Here, before at findings, a quick note on the 3 frameworks that guided our analysis. DHI uses 3 readiness levels: technology readiness levels, or TRL, business readiness levels, or BRL, and service readiness level, or SRL. These frameworks help innovators assess where they are on the journey from idea to adoption. It was central to how we analyze the ecosystem. Well, these slides give you the analytical foundation for the rest of the presentation. On the left, you can see how we organize the 59 organizations across the quadruple helix: 7 from industry, 18 from academia, 22 from civic, and 12 from the third sector. And on the right, you have the 10 support functions we coded, from funding and mentoring to regulations, service delivery, and innovation enablement. Well, these 2 dimensions, domain and function, we will be referring to throughout the findings. Next, please. In this slide is insight number 1. Now let's look at the first set of the insights from the text review. We found 4 key things. First, the good news is a diverse ecosystem spanning all 4 quadruple helix domains. Secondly, we found a strong concentration of support in funding, mentoring, and networking. That is where the energy is. Thirdly, and here is where it's getting interesting, limited provision of regulation, service delivery, and advocacy support. And finally, a predominance of support at the earliest stages between TRL 1 to 3. Well, now I'm going to talk about what the system actors told us in the stakeholders consultations. 4 themes came up. First, functional specializations by design. Organizations operate under defined mandate that is defined is how they work. Secondly, the crucial one, navigation, is the bottleneck, no provision. The support exists, but access depends on informal networks and tacit knowledge. Thirdly, regulation enters the conversation too late, and the technology is already advanced. And finally, innovation timelines don't match NHS processes for testing, governance, and adoption. Their own conclusion was clear. What this ecosystem needs is better coordination, not new organizations. Next, please. Finally, the most revealing voice, what the innovators themselves told us is they told us they struggle to find clear entry points to the right support at the right time. 4 findings stood out. For example, first, a strong familiarity with TRLs. TRLs work as a shared language, but business and service readiness, by contrast, are rarely discussed. Secondly, the NHS is perceived as hard to access. Some have explored clinical validation or scale up outside Scotland or even outside the UK. Thirdly, heavy reliance on informal networks. Without clear signposting, progression depends on who you know. And finally, regulatory awareness emerged too late, leading to redesign and added cost. And with that, I'll hand over to Dr. Sanna Rimpiläinen to continue with the next part of the presentation and explore the wider implication on these findings. Thank you very much.
Thank you, Yazmin. Okay, so I'm taking the story on from here, and this is really the headline news from the report collated in one place. So we have on the zone of strengths in Scotland rich provision of funding, mentoring and training at early stages. There's a strong academic and civic infrastructure for ideation and prototyping. And as Yazmin has already said, the technology readiness levels are widely recognized as a shared language among the entrepreneurs. And there is an active community of digital health entrepreneurs in Scotland. On the other hand, on the zone of critical gaps, we see the support thinning out as innovators approach adoption. So this is around technology readiness level 69. It seems that regulatory and service adoption awareness emerges too late in many entrepreneurs' field of vision, so to speak. There's no clearly signposted path between the support functions and organizations. And we also discovered we wanted to also map out the digital social care innovation support available in Scotland, but we discovered that there's limited number of, or that this support exists, but it isn't very well made available, or so on the publicly available information on the websites, for example, digital social care innovation doesn't really appear in the search functions when you look at that. So basically, Scotland has a functional pipeline from idea to prototype, but it stops before adoption. And this, in other words, this means that the ecosystem has been built around entry, but not for adoption. And here's a kind of heat map showing the same picture. So at the top of this heat map on x-axis, we have the technology readiness levels, and on the y-axis are the 10 support functions that were coded. And I need to highlight that these aren't in any kind of chronological order, because they can't be, because the support functions can appear at every level of readiness. But what this map shows, where the color is darker, the support concentrates in the earlier stages, and that it kind of critically thins out where the adoption critical support meets adoption stage maturity. So discussing these gaps in more detail, the regulatory awareness seems to emerge usually around the mid-technology readiness level stages between 4 to 6. And this is too late in terms of technical development because it should really be considered at the idea and concept stage. The consequences of this is that it may result in costly product redesigns at later stages. This can also cause friction with healthcare providers, which is avoidable if these were considered earlier on. This may cause delays in NHS adoption, sometimes in years, and it can also lead to project abandonment for resource-constrained innovators. Secondly, the innovators told us that accessing NHS is hard. So unless you're already within the NHS, it's really hard to identify a test bed, how to access a test bed, or how to find the right contact to create that kind of connection, because there are so many health boards and they all operate slightly differently. So it often the reliance you're relying on your personal connections or on chance or luck in finding the right way in. And this may lead to innovators taking their innovations elsewhere, trying to validate these or scale outside of the Scotland or the UK. And yeah, so it just means that people are looking for another way to progress their work if they can't do it here. And thirdly, relating to what we discussed earlier, the navigation really depends on who you already know or on your tacit knowledge. So not only with the NHS, but across the other support functions in the ecosystem. So the problem isn't the provision, it is understanding where to go next. So this means in practice that entrepreneurs are facing unequal access to support. This may slow down innovation cycles because people spend time and energy in searching where they should go next rather than focusing on progressing their innovation. And this is a loss to the ecosystem because promising ideas may stall, or they may be abandoned, or they may be taken out of Scotland, basically. So where should we go from here? Our report had actually 6 recommendations, but when we looked at them more closely, they kind of can be whittled down to these 4. So the first one is building system level coordination function, or a navigation tool or navigation support. So this would strengthen alignment across the existing organizations and also help the innovators to understand given what level they are at, where they should go next. The second recommendation is making readiness a shared language. So innovation readiness, a shared language across technology, business and service readiness level understanding. So these considerations like how would I develop, what kind of business model should I have, and what kind of client do I have, and what is the client's readiness, services readiness to receive my innovation? Can I work with the recipient client to help them be more ready to receive this innovation, or should I adapt my innovation to better suit the recipient client? So those kind of considerations should be taken into account earlier on. Raising regulatory and adoption awareness earlier, and this could also happen in conjunction with this navigation support. And finally, bridging the gap between digital health and social care innovation. So identify, articulate and amplify support available for innovation in digital social care. So overall, what this recommendation says, that there's plenty of players in this field already, but we just need to have a better map as to how to kind of travel through this as an innovator. And what these recommendations would lead to is providing stage-aware readiness, informed guidance to the innovators, and reduce reliance on informal networks and tacit knowledge, making the innovation processes more efficient. So as was mentioned earlier, this report was published only last week on Wednesday, together with another report from the DHI, which was a deep dive into digital health and social care industry sector in Scotland. And the reason why we published this together is that both of these reports, while our report was looking at the innovators and entrepreneurs seeking to enter the industry, and industry was looking at how this industry could be scaled. Similar issues were identified by both reports, which may play into reducing or slowing down the growth of this sector. And these were, I won't spend any time in going through this report, we've got a link to it later on, but basically around regulatory path and environment, funding to scale, market access, and additionally, the other report identified skilled talent shortage, which is something that DHI has identified previously already in other pieces of work. So here are the two reports. Ours is on the left-hand side. So if you want to access these, you can scan the QR codes. I'm going to leave this here for a little while so that you can scan those codes if you like. And I'll hand over to Gillian and Francis. Thank you.
Thank you so much, both. It's so interesting. I mean, when we first spoke about the completion of this work and your intention and how you were going to complete it, there are other ecosystem mapping reports out there, but I think where this one is really different is it's bringing in that innovator experience and actually provides evidence on people's real lived experience of trying to navigate the ecosystem. I think everyone who's involved in it knows that it's challenging. We know that there's issues accessing support. We know that there perhaps isn't the right support at every stage of the process, but I think this now gives us the evidence to look at those challenges differently and think about how we're going to meet them.
Yeah, thank you.
We got any questions from the chat, Francis?
Really interesting. Some questions about the difference between the kind of early stage and later stage innovators and their ability to navigate the system, just because it's so complex. So I think they're just asking around about what factors are involved in the difference between those type of.
Okay, Yazmin, would you like to, given that you spoke to the entrepreneurs, do you want to try and answer that question?
Yeah, well, I am the entrepreneur. I think I can understand how is the difficulty to navigate inside this new ecosystem, because we have really strong in the earliest stage, because I am in the earliest stage. I can find many organizations support in this area, but in the other hand, we have a barrier with the other innovators that they can go into the next stage and explore, for example, regulatory and governance problems. And that is the gap. We need to coordinate better in terms of objective in each organizations. For example, I think that there is a real momentum, the care in digital health age and the national programs and national policy can support this gap, because this can provide some problems in economic problems, because the majority of organizations are funding and the innovators in the earliest stage. But what happened next? What happened when they are going directly to the market, to the real economic system? Because that is crucial. And the other thought that I now remember is the majority of innovators that has more success is come from the academia. And what happened the others? What happened, for example, Sanna explained about social care innovators. What happened with this group? They don't have a lot support than the fintech, for example, because we know the organization support mass on that area. And additionally, I think it's not just this problem or this gap or this coordination in digital health is in the different areas, but in digital health, we are working and creating solution for person and illness. That is a really, really, really important part. And that is for me, is a crucial part we need to improve that, the coordination.
And what do you think that DHI could offer to help those people then improve that and help people kind of get further on with their innovation?
Sanna for me or Sanna?
It's for you. You have the mic, Yazmin.
Yeah, go
I'm
on.
sorry. Because you are saying Danish, I think, oh, maybe it's for Sanna.
For Sanna.
Could you repeat the question, please?
Another question came in to say, what specific services then do you think would help, you know, with those initiatives for to assist that kind of a challenge within the ecosystem to navigate?
Yeah, I think we have a plan. We are thinking about how can I resolve this problem, or how can I provide solutions for the entrepreneurs. You know, in the Scotland, we have a strong background in different universities that now I'm supporting in incubators, especially. But we are thinking to connect the knowledge. How can I provide information in technology readiness level and business readiness and service readiness too? Because this is a gap. Sometimes the innovator just think in the solution and create the solution, but they forget the other parts of the solution. And when they realize that is important, because I need to think in governance, regulatory, of you are creating a device, for example, you lost probably 1 or 2 years finding the solution, and you lost probably going to directly 3 years, 4 years, probably never going to directly to the real users.
Yeah.
And that is a gap. Or
Yeah, I think
probably
there's a lot around that language, because obviously we all talk in TRLs, and I think it's because early stage innovators are possibly looking for grant funding. Grants are linked to TRLs, so we subconsciously force people to very much become focused on their solution without thinking about the business readiness level, the service readiness level. How are they actually going to grow it? How are they going to scale it? How are they going to implement it into service? So I think there is a lot of work to be done on focusing our innovators to think about the wider picture, to be ambitious with their idea, to not just think about the technology, but how it fits into service and how they can really grow it at scale. Because we force people down that route with the way that we fund those early stage innovations by linking them to TRLs.
But the TRLs could also help with, like, once if we get funding to take this thing forward. So the technology, business and service readiness level awareness, like what level you're at, could help. We could peg the different organizations that offer the support functions at those technology, service and business readiness levels. And that would help create the map that would allow people to say, like, if I'm now at level 3 in TRL, what do I need to do to get level 4? Or if I'm at level 1 on BRL, what should I do to try and progress, and where do I get the support for that? So it's not a complicated thing to create. We just, but if anybody has any money, please let us know. This would be a really, really small investment for a big kind of benefit for the ecosystem, I think. Anyway, sorry, this was a kind of slight.
No, it's really interesting all that, because Gillian just spoke about, you know, there's a question came in about understanding the requirements of each regional health board as well, to kind of a buy into the different levels. So, you know, and how that kind of aligns with clinical priorities as well, and how that all marries up into the one system, and then how they take their innovation. And you know, sometimes unfortunately it is who you know and what a key opinion leader that you know that can carry that forward for you. So
yeah, precisely.
So there's a question came in about that. So Gillian, you must have read my mind when you chipped in there. So yeah, no, really interesting.
I think there is always going to be elements of it can feel smoother for other people because they might have a network, but I think truthfully, to seek support, you might contact InnoScot. If it's not something that we can support with, we ourselves are quite well networked, so we will perhaps put you on to DHI or to another ecosystem member who might be better placed to support with you. What I do see now is lots of willing in the system. I think we collectively, we being the service providers, recognise that there isn't, not one of us is capable of providing, as you say, that end-to-end support. And there's lots of willingness to help where we can and pass on people to other organisations where we feel that they're better able to support, but also to work collaboratively as well. The ongoing issue of funding and how to support programmes moving forward is always going to be a challenge. I don't see it getting easier anytime soon. So there is that willing to work together where we can to leverage the best use of that funding.
Yeah, funding is always a difficult
Horrible.
word. But I would like to say that for the new entrepreneurs, this encourage them, because it's not easy. Anything is easy, but if you really want and you are passionate about your creation, your solution, you will find the right organization, and that is a really good thing. It's a really good news. The other things that this coordination about the ecosystem, we can't resolve it during the time, but for encourage the innovator, it's important for increase the innovation in Scotland. That is, for me, is my vision, to encourage the innovators while we are trying to resolve this coordination. But yeah, I think InnoScot is a really good organization that I know support in different areas to the new innovators in different stages, and that's so impactful for the innovation ecosystem in Scotland. And say, yeah, this is a really good organization, has expert in different areas, like and I say, just focus on your passion, solution, and keep going to go to the events like that, like this type of events, and you will find your organization.
Find your people.
Yeah, be positive.
Do you
think we can learn from other countries? Is it similar back home, Yazmin, or is it complicated? Or Sanna as well? I know that you're not. No,
I have to say I really don't know, but
Yeah.
I'll see what Yazmin has to say.
I think honestly, navigation challenges exists in every sector. It's not just in Scotland. In Europe. It's a specific ecosystem because we have more AI ethics than the other countries.
Yeah.
And that is positive, but at the same is a barrier for the innovators. We have a GDPR, data protection, AI acts. For example, in the USA, they don't use AI acts. And that is the reason some mentors give you an advice. You can explore in American stage your innovation. That is a barrier, because probably the government should to be a partner of the innovator and explain, oh, you need to do that. We can support you in this part with this organization, and you can navigate easily in the innovation ecosystem. I think that is a specific here in Europe, but it's different in any country. Now I'm from Chile. In Chile, we are the first country in AI, and we are creating the innovation ecosystem. But I think, yeah, it's difficult, but we are in the crucial time. We can to reorganize the attitude or the organization here.
Nothing else coming in, Gillian?
So this is the last of our webinar series for our summer break. There's no session at the end of June or July. We will be back in August for our autumn term. Obviously, you can catch up on our webinar playlist on the InnoScot YouTube channel. The team are actually out and about at a few in-person meetings over the next few weeks, so lots of opportunities to come along and say hello. On the 3rd of June, sorry, these are actually mixed up. The 3rd of June event is a regulatory readiness workshop. Will be in person at Discovery Point in Dundee, and that is a meeting where we're bringing together founders, regulatory expertise and some investment expertise all in the room, willing to share their experience and talk about pitfalls, how people have gone through the process, things that have worked for them, and crucially what investors are really looking for in the throughout the pipeline at different points of investment. On the 10th of June, we are joining T Health Tech at their event, The Gathering, which is a review of how that project is going so far, an opportunity to catch up on funded projects and talk about plans for the future for the T Health Tech programme. As I said, our sessions start up again at the end of August. We're always open to suggestions if there's something that you would like to see covered, particular parts of our expertise or our pipeline that you'd like to focus on, or crucially, if you would like to come along and present your work, we're always happy to hear from you. So thanks so much for coming along, and thank you so much for Sanna and Yazmin to be so generous with their time and come along and share their work. That was really useful. We could have talked all day on it. I think it's difficult to not fall down that rabbit hole of talking about how challenging things are, but I see a lot of optimism in this work of areas where we've got things to work on, and I think identifying those issues is quite often part of the problem. So your report bringing them all together in the one place is really, really useful. So I hope our attendees found today's session useful as well, and the reports are available for download. If you've got any questions,
put them in the chat as well.
Yeah, put them in the chat as well. So if there's any questions on the back of that, just reach out to the team and we'll be happy to put you in touch. But thanks very much, everyone.
Thank you, Frances. Thank you, Gillian.
Thank you.
Bye-bye.
Thank
Bye
you.
for now.
Bye-bye.